Welcome, everyone. I'm excited to welcome you to this episode of the Sunflower Podcast, a podcast exploring all aspects of children's palliative care around the world. Sunflower Podcast is bringing curiosity, humor, and reflection to the world of palliative care. We're exploring the joys and challenges of working in this incredible field. Hi, everyone. I'd like to welcome you to a special episode here on the Sunflower Podcast, where I have an amazing group of people who have been supporting leadership within pediatric palliative care around the world. And I'm excited to have a conversation with everyone. So instead of using my voice, I'll go around the room and have you guys introduce yourselves and how you got into pediatric palliative care.
Hi, everyone. I'm Smriti Khanna. I'm from Mumbai. I practice in Mumbai in India. I got into pediatric palliative care about 7 years ago because I did a lot of pediatric hemato-oncology, and this seemed like the next step. I got into pediatric hemato-oncology, and this seemed like the next most natural progression to me.
Thanks for being here. Laura.
Thanks, Rachel. I'm Laura. I'm the founder of Global Treehouse. And I was thinking about your question. I first came into palliative care through social investment. So about 10 years ago, I helped design and launch what's called an impact bond. And I think it was the first in palliative care. And then I think the reason why I've stayed in palliative care is because it combines, I think, some of the most hopeful people I've ever met with some of the hardest questions in healthcare.
That's amazing. Thank you so much. And Justin.
Hello, Rachel. Thank you so much for having me. My name is Justin Baker. I'm also known as the Chief Koala Bear. And so koala means quality of life for all. I actually am a hematologist, oncologist, and a hospice and palliative medicine doctor. I am the chief of the Division of Quality of Life and Pediatric Palliative Care at Stanford Children's. I had the great privilege of spending 20 years at St. Jude Children's Research Hospital also. I've been in the field now for just over 25 years, which is crazy to say. And when I think of what got me into pediatric palliative care, it's actually very clear that this is exactly what I was put on earth to do, that God put me here to do this work. And I'm just very grateful that at the time, 25 years ago, pediatric palliative care was a brand new field. So I'm so thankful that it found me because I've been able to really grow with the field, and I've seen my leadership grow. I've seen the field grow. I've seen the impact grow, and I've been so grateful to have been a part of it.
Thank you so much. What a story. Ximena.
Thank you, Rachel. Thank you for having me. My name is Ximena Garcia. Currently, I serve as the program manager of the Global Palliative Care Program at St. Jude Children's Research Hospital. But my journey in palliative care started more than 10 years ago in Colombia. I am from Colombia, and I am trained as a pediatrician and palliative care physician, where I had the opportunity to evidence firsthand the suffering of patients and how much we can do to relieve that suffering with the right approach, with the right training. And so I said to myself back then that there's a lot of things to do and to improve and impact patients and family. And that's how I got into this beautiful journey of pediatric palliative care.
Thank you so much. I think the theme seems to be pretty global in terms of why people have found palliative care. And I think it really does find people. And people are stumbling into this work on purpose, which is fantastic. Thank you for sharing your stories. What I'd like to talk about today is leadership within pediatric palliative care. And as people have been hearing in a series of episodes, the Sunflower Network had a leadership project with the intention of building leaders within pediatric palliative care globally. There's also sort of step 2 of this leadership project called the Catalyst Lab, which is just launching this year. And so I know that all of you in the room here have been leaders and mentors. And so I'd love to just hear about how you got interested in supporting this work, why you think building leadership specifically in this work is so important. Maybe I'll start with you, Justin, and what brought you into supporting this leadership work?
Thank you so much. Yeah, this is an incredibly important project. I've been working in global pediatric palliative care for quite some time. And one of the limitations I always see is as we work through education, as we identify people who are really committed to the field, it's very difficult to change the system within which they are navigating. And so we realized that leadership was a real gap. And as soon as Megan, Dr. Doherty came to us and said, hey, this is exciting, we've got a chance to impact the field through leadership, it was a no-brainer. It was very clear that this was a gap. It was very exciting, the team that came together around this project. And when I think about the issues related to leadership, those issues related to influence and impact, and then when I really contemplate the word effectiveness, I think this is something that we've not historically taught very well. We've taught content, we've taught even behavior change. The thing that we haven't really taught very well is leadership. And so to be a part of this, especially a project-based leadership program, meaning we help guide people through the establishment of these projects, it has been absolutely incredible. And to see the impact has been so rewarding.
Thanks. Yeah, I think that's actually a really interesting point, that's actually not something that is actively taught in our training, and a major gap, because there's so many well-meaning people, like all of you identified in intros, like really wanting to do this work, but there's so many barriers and red tape and system issues that require a different approach. Is there anyone else that would have something that they'd like to comment on, or maybe what brought them into wanting to support as a mentor, as faculty in this leadership work?
In addition to what Justin said, it is about responsibility for reducing suffering, and even when the system is not ready for it. So I found out that learning and get trained in clinically in pediatric palliative care is easy and it is well available. But the skills to lead, to empower others, to convince governors or to convince leaders, it requires a specific training. And that's why I got into this leadership project, which I think it's essential. And if the pediatric palliative care clinicians have, in addition, these skills or training in these skills in leadership, the field will advance even faster than it had been in the past 10, 20 years. So I'm grateful with Sunflower and Megan Doherty for her leadership in this, and excited to see what this project is going to move the needle forward in this young field.
And you mentioned Megan, and I guess it always starts with people. And, I remember meeting Megan and Spandana, and we bonded, over, I think, a shared frustration. And we also bonded because Spandana and I share the same birthday. But we bonded because of a frustration of, children palliative care is one of these areas where actually a relatively small investment in the right people can really change, to Justin's point, what's possible for families. I've met so many leaders who build so many things almost by forces of will, often quite isolated, carrying so much sort of emotional but also operational responsibility. And I'm convinced that it's one of those rare spaces in health where leadership really can determine whether care exists or not. And so that I love that about Sunflower, is that it sees leadership as part of, as infrastructure, not a nice extra, if you see what I mean.
Yeah, thanks, Laura. Smriti, I'll hand it over to you.
Thanks, Rachel. I have, over the last few years that I have been working in pediatric palliative care, I have started to think of it as a revolution. And if you think of the number of people that need to make this change in their sphere of influence, it could be a hospital, it could be a community, it could be a hospice, it could be an outpatient unit. You need a leader for every revolution. And you need a leader who knows what they're doing, who has the right kind of support, who has a system where they can ask questions, find answers, connect with other leaders. I think that's what gets the revolution going forward. And that's the reason why I think the leadership project, the Catalyst Lab, all of the work that Two Worlds is doing is so important, because we are just bringing so many people together. And it's so inspiring to just watch and learn from everyone. It helps, it spurs you forward, and it makes you want to do better and to be better.
Well, I think you're inspiring, Smriti. Thank you.
Yeah, I think, Smriti, that's a great word, revolution. The other part that I like to think about is disruptive. And when I imagine disruption, these systems are built basically to cause harm, unfortunately. And so our medical systems so frequently are built not to properly address suffering, but instead often to inflict suffering. And it's hugely problematic. And nobody goes into medicine not wanting to help. And then at the same time, when the system gets moving the wrong direction, it's quite often that our patients and families get caught up in it in a way where all of a sudden all these things get done to them, or the system completely misses them altogether. And I think what we have to do is be disruptive. And I think the other part of this that we have, and Smriti, you were beginning to talk about this, is we have this inarguable cause. There is absolutely nobody in the world that says there should be more children suffering. No, I mean, everybody says, yes, children suffering is the perfect uniting entity that we want to be motivated around. The issue is, how do we change the system? How do we disrupt this? How do we cause that beautiful revolution as we're thinking through it? And the issue that ends up happening is you have to have leadership. You have to have the ability to break a cycle. And it takes skills like Ximena was just talking about. It's not luck. It could be a force of will, Laura, but those people are the people that are now leaving the field because they're burned out, because they hadn't gained those skills. And so it just took absolute determination to basically stop that cycle and build new programs. And that is at their own personal expense. It's through these leadership skills, it's through programs like this that we can make the largest influence and continue to grow the leaders themselves.
Thanks. I think those are some remarkably powerful words of revolution and disruption, because we are often, I think, viewed as a soft subspecialty in palliative care, and we hold hands like nobody's business. And I love that these are bold words for building these programs. I think about some of the people I have had the privilege of working with that I have seen as leaders in this field that have single-handedly built these programs from the ground up purely out of spite for the way the system works, right? And so it really is a revolution, Smriti. I love that. The fact that we have been able to find leaders that then have people surround them, and then it grows. When you find those really skilled and maybe natural leaders, there's been identified that it's also a skill that needs to be learned. You have followers, and then those followers become experts and learn how to become leaders. And then we see that exponential growth in the programming. What do you think are some of those key insights or learnings from doing this project work as like mentors and faculty? Like, what are some of those key things that we need to teach or that people need to learn in order to become more effective leaders in this work that you wanted to focus on as a mentor?
I think one interesting thing that I think leadership teaches you is how to live in the contradictions. You've got to be hard, but you've got to be soft. You've got to be a go-getter, but you've also got to be patient. You've got to, I don't know, maybe raise your voice or shout that things are needed. But at the same time, you have to know who to approach, how to approach, what can you ask for, what can you actually demand. And I think this is one of the hardest bits of leadership, because if you are going into a new system, or rather not even a new system, you are going into an established system full of vim and energy, as Justin said, you're going to burn out if you don't know the right way to navigate it. And that's probably the reason why, Rachel, you spoke about how people gather together. When there is something wonderful going on, it automatically attracts more and more people, and you end up finding your tribe, so to speak. And the wonderful thing about all the work that Tools is doing with the leadership is that it's giving it a structure, and two, now you can find your tribe anywhere in the world. It's not local. It's not just within the boundaries of, say, where you're operating, where you're working. You have the connections to be able to find people all over the world. They will give you a fresh perspective. They will tell you the things that they have already done before, and they will walk hand in hand with you. The wonderful thing is that someone who is just starting a pediatric palliative care unit can get on-ground advice from Justin, who's been in this field for 25 years. And can you believe that that is possible? It's amazing.
This is a group of people that make anything possible. that do this work. Laura, do you have thoughts around some of those leadership skills?
The first one, and it feels so important, I know we've talked about it, is it's not luxury. I think, Justin, you sort of brought that point, like so many things and services exist because one person decided to challenge not accept the status quo, but we can't build good care systems just based on heroes. So I guess that's just really important to me. And it's something you see so strongly with this cohort and approach. I mean, I love the possibility discussion, you're having, Smriti, confidence and imagination really matters. And my experience with mentee over the last sort of 3 years is that none of them really needed someone to hand any answer. It's almost that permission or whatever word to think bigger and to realize actually we could do that. And maybe the other thing, which I love, and I'm biased, I come from a healthcare innovation, system change, I'm not a clinician, is that sort of cross-pollination of, clinicians, storytellers, system thinkers. For example, last year, there was a moment where we decided to share short films between sessions. Some were led by Indian filmmakers, some by volunteers in hospices, some was a Brazilian team of nurses, and just to sort of, create a space where new ideas might come.
Yeah, Laura, I really appreciate what you're saying there too. I think there's a component to this that people don't really recognize, that is building this coalition. And there's this coalition, the most effective coalitions are rarely all clinicians. We need politicians, we need advocates, we need parents and children to share their voice. We need innovative approaches in technology like you are leading. We do need superstar clinical leaders also, but we also need hospital administrators. And so as we kind of think about building the coalition, it's quite common that people don't really think about that part in their leadership journey. I think another skill, Rachel, that we do a lot of work around is how do you create your pitch and kind of what is the gap that you're trying to address? And very often people are thinking about this well-developed, well-oiled machine of a pediatric palliative care program. They're thinking about this huge thing 10 years down the road. They're thinking about Gayatri Palat and her program that she has in Hyderabad. And, that took her 20 years to build. And so the issue that we have to help people think through is how do we get to that next small step? And then I think a big thing that we don't do very well is we don't celebrate our little wins. We have to really pause and celebrate. And I think this is a part we've talked about, resilience and well-being and burnout. And I think so often we're so driven and so thinking about that 10 years down the road plan that we don't pause and celebrate the little wins. I also think one other skill that we don't really contemplate and actually we're quite bad at, and this is definitely a limitation of mine, are things like budgets. So we have to think about finance. We have to think about how do we actually fund this thing? And that's absolutely essential. I now oversee a very large budget. It's my least favorite thing to do. It's the thing that I'm actually the worst at, but I'm growing in it and I'm trying to learn more about it. And I think this is an essential skill as we're helping develop leaders moving forward.
And I think that highlights, there's a lot of us clinicians that volunteer with Two Worlds, and we don't have a lot of non-clinicians that are doing some of that other thinking and the other work. And I think there's a lot of us clinicians that really dislike the budget side of this work, to be honest. So I think you're right. That's absolutely not tapped in. But I also wanted to comment on Smriti's balancing of two ends of a dichotomy of being hard and soft, and when to shout and when to politely bow your head and ask. And, when to have a cup of tea with that hospital administrator and just butter them up to why they need to advocate for palliative care, and when you have to go to the streets and really, really put your foot down. And I love that. And I think that's a really difficult skill. If you can hone that, I mean, I feel like Dr. Gayatri is probably one of those that has honed that skill. And so, Justin, to celebrate a little bit, I did see an announcement this morning that she has opened up pediatric palliative care beds at Nilafur Children's Hospital that I remember back in even just 10 years ago, we weren't even allowed in the hospital. So I'm just going to take a quick moment of this to celebrate that. What a fantastic little win not little, it is a win for her. Ximena, do you have any comments around the skills and what you think are key points?
Thank you, Rachel. Well, after hearing everyone and these key words, I would like to add another key word aligned with Justin, aligned with coalition. Because after everything that we have discussed today, one of the key insights is that solutions don't come from one place. They are co-created, and this field requires a kind of leadership that needs to bring ability to listen deeply, bring diverse perspective together. We just talking about how not only clinicians are important in this mission, but other fields are also, and create a space to share knowledge, to brainstorming, create new ideas. And ultimately, advancing pediatric palliative care globally is not just about knowledge or clinical expertise. It requires leaders who can connect people, navigate complexity, and think in systems while inspiring others to move this world forward together. So it is amazing to share actually this podcast with such a diverse group of amazing human beings. And this is what we need to bring in every space that we are going to talk about pediatric palliative care.
I couldn't agree more. And I have always said, I'm so glad that there are different people in this world. The people that think system wise, like Laura, the work that you do and being able to see that picture differently than I do. And I love holding children and racing wheelchairs down the hallway as part of my work. And then there's some that are numbers based and can do some of that budgeting and accounting. And I am so grateful that there are so many different people that can all do this work, because it takes a whole variety of people to make teams. If we were all the same, these teams wouldn't ever grow or expand or turn into anything else. To kind of close up, I would love to hear about what all of you are hopeful for. That's how I like to end these things. There's been so much good work in the last couple of years with this leadership work. In some of your work and your mentorship, what are you seeing that maybe is really clicked for you that you're hopeful for?
Rachel, as I think about that question, it's actually one of my favorite questions, because there is so much that we need to be hopeful for. And again, we have the unifying theme, and in the middle of the incredible pain in this world, as Smriti referenced earlier, we in some ways have at least one of the answers. We have this incredibly beautiful revolution that we get to be a part of, that can bring people together in a way where people from tremendously diverse backgrounds who might disagree on all sorts of other fronts can be united around this. And so I have tremendous hope in that. It's also very helpful, as I've been in the field now for quite some time, to see the rapidity of growth. And when I think about a country like India 15 years ago, there was basically no pediatric palliative care, or there was functionally no pediatric palliative care. And at this point, there are people growing and leading in ways and developing programs that are revolutionary, truly incredible, making a profound impact. And so there's tremendous hope I draw from that. The last thing I draw hope from is groups like this, the people that we get to work with on an everyday basis. In a podcast like this, Rachel, it's very rare that you might get goosebumps, which is what I have right now, or feel the depth of love that I feel and connection I feel with each of our co-presenters here and with you. This field is full of love. And I wrote there in the chat that this crew ain't soft. It ain't soft. And yet we are certainly filled with love for one another. And that love gives me tremendous hope.
Rachel, I think my hopes are simple and so aligned what we have talked today. And it's to continue building a stronger and more connected systems where palliative care is integrated early and in an equitable way, and that more local leaders are empowered to drive change in their own context. When I started pediatric palliative care 10 years ago in Colombia, there was no training, no formal fellowship. And now recently and very proudly, I can say that this year, a group of people like me were recognized as the first specialist in pediatric palliative care and pain management in the country. So it is possible. The change is possible. The improvement is coming, and we just need more empowered leaders like who we are seeing today to make this change sustainable in time. So thank you for providing this space to talk about this.
That's another really good celebration. I love it. Thank you. Laura, any thoughts about hopes for the future?
Ximena stole my biggest hope. I would add thinking about the leadership program, I'm really hopeful because this next generation or existing generation of leaders seem deeply collaborative. That's one. And honestly, I'm also hopeful about technology and AI as, not replacing human care, but really helping expand, the expertise of some of the people in this call, reduce isolation, and support families in ways that simply weren't possible before.
Smriti.
I have two big hopes. The first is that things are happening faster. They're happening faster than they have happened ever before. This is what Justin was also saying. The speed with which we have new services developing, we have more and more recognition of pediatric palliative care services. Dr. Gayatri got honored with an award just before she actually received this news about the new beds that she has opened at Nilofer Hospital. And, the other thing is that everybody seems so much closer now. The first time I heard Ximena speak, she spoke about the palliative care unit that she had developed, and I was floored by that unit. The way she described how she developed it. And now to know that she has received the recognition that she deserves because of it. And not just her entire team has received this recognition. And I can get updates on what's happening in Colombia, on a day-to-day or a week-to-week basis. And I know the amount of work that Laura is doing with her Magnify tool, with Global Treehouse Foundation. The fact that there is someone in this world who is hopeful about AI makes me hopeful. And I'm very glad to you, Laura, for that. That's a lot of hope. I'm really glad.
We identified this at the beginning, and so it's such a good circle around that pediatric palliative care providers or people that are in this work are actually really hopeful people. There's so much stigma still about families losing hope and us taking away hope. And I love this question at the end of my interviews because there is so much hope. The work that people are doing is so inspiring, and the passion that each of you have is so apparent. And my comment to technology too is never did I imagine having global conversations on a video chat that we could turn into a podcast. And I think about one of my early visits to India where we were just starting to use the iEcho platform for training radiologists in Hyderabad. And now I'm teaching on iEcho to 150 nurses globally on a regular basis. And so I think technology has really allowed a connection. And I love those comments, Smriti, of, waking up to a WhatsApp from my nursing friend in Nepal that I just got to spend time with last week. Like it has connected us globally in a different way where we can be inspired by each other. And that is one thing that is so true, that I am utterly inspired just by this short conversation with all of you. I love following the work that you are all doing. We can all build and grow our hope from seeing each other and the work that's being done globally. Justin, do you want to give us your quote?
Emily Dickinson wrote a beautiful poem called Hope is the Thing with Feathers. And we are indeed a very feather-filled folk. I think that's what we are in pediatric palliative care. And Laura, as you said it, I really do believe also that connection is such a huge part of this work. And it's through that connection that we have such deep hope.
I want to thank all of you so much for taking some time out of everybody's incredibly busy schedules to have a conversation. I am absolutely thrilled to have been able to chat with all of you. So please continue to keep doing the amazing work that you're doing. I wish you guys all the best. Thank you for listening to this episode of the Sunflower Palliative Care Podcast. These podcasts grew from a seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration, which focuses on children's palliative care. We hope to build a world where no child suffers from serious health-related issues. To learn more or to donate, please visit twoworldscancer.ca.